The COVID-19 pandemic left grim memories in the minds of many Ugandans, especially those who lost loved ones. What began as a rumored illness in China in late 2019 quickly spread across the globe like a wildfire. By the time of the last official update, Uganda had registered 172,149 cases and recorded 3,632 deaths. Most of these deaths were due to the severe damage COVID-19 caused to the respiratory system, especially in patients with underlying health conditions. While over 100,000 patients recovered, health experts agree that the stress on the country's health system was unprecedented. One of those on the front lines was Dr. Rosemary Byanyima, Executive Director of Mulago National Referral Hospital, which handled a significant number of COVID-19 cases.
So we actually opened Block A, specifically starting from the Ward 1A, because it's the one who are utilizing even for screening, and those who would test positive then would admit them on 2B, which was just a level above. So we kept the activities due to COVID in one area so that Upper Mulago can continue attending to all the other patients.
The outbreak exposed just how limited the country's capacity was in terms of medical supplies and infrastructure. Even with donations and government support, demand for oxygen alone far exceeded supply, leading to skyrocketing treatment costs, especially in private facilities. Dr. Ruth Aceng, the Minister for Health, remembers those days vividly.
The COVID-19 pandemic provided a great opportunity to strengthen the system, and government invested heavily in ensuring that our system is strengthened. And when we talk about strengthening the system or building resilience, it is not only focusing on outbreaks, but it focuses on the entire health system.
One major shift was investment in critical care infrastructure areas, which were previously underfunded or ignored. The pandemic made their importance undeniable.
The laboratories. Uganda has a laboratory system that goes down up to the communities. We are able to station mobile laboratories anywhere in the country. And these mobile laboratories are level 3 laboratories where we can test any pathogens that are of the viral hemorrhagic fever series.
But in the private sector, costs spiraled. Many patients were forced to purchase oxygen cylinders for use at home. Self-medication became widespread as hospitals filled up. Dr. Lamek, Ssemogerere, the head of critical care and rapid response at Nakasero Hospital, says few people understood what intensive care actually meant until the crisis hit.
Everyone was looking for where these places are. Unfortunately, the country was so bad at these services. And again, because of lack of awareness, government had really not invested much into these services. Private hospitals did not invest much into these services. They were considered services of the rich.
He notes that prior to 2020, Uganda had only 55 functional ICU beds, scattered mostly between Mulago and a few private hospitals.
But what COVID did is that everybody was awakened, and the country together saw the need to establish these services, because after that time, every hospital has established something similar to ICU or HDU, where they can place these patients who are really too sick to be on the wards. And this is a good thing, because right now we are trying to look at the post-COVID capacity that we have developed. But even before the research comes out, we can tell that the numbers of critical care beds in the country has really escalated. I remember in 2020, for example, Nakasero Hospital had only 8 beds of critical care. And these beds could barely get full because, people didn't know much about them. Occupancy was about 50%, which means about 4 beds. As I speak right now, the hospital has a capacity of 12 beds, and they're almost ever full, which means that even those are few. But given the nature of the service, how costly it is, how difficult it is to establish, it is very difficult for any hospital to make so many beds. Even if we don't have all the beds we need, right now we know what it takes to create one.
Minister Aceng confirms that government has built permanent ICU facilities in at least 5 regional hospitals, moving equipment from emergency setups to purpose-built structures.
Now, this is not only for outbreaks. It manages various other conditions, whether neurological, whether medical, whether pediatric, whether it is related to injuries. Currently, government is investing in constructing intensive care units to accommodate these equipment, and government is also investing in training anesthesiologists and critical care workers to run the intensive care units. I will not forget the investments in oxygen. All the regional referral hospitals have PSA systems of 100 nanometers. Now, this is big enough to supply an entire region. So all regions are able to supply oxygen to the lowest level, and that may be a health center too, where we have not upgraded. So we have excessive oxygen. The only challenge with the oxygen system now is the power that goes to run the PSA systems. In addition to that, we also have liquid oxygen that has been installed in national medical stores and Mulago to complement the PSA system.
She adds that surveillance and research capacities have also been enhanced.
For example, in regards to the influenza series, we have sentinel sites all over the country. So anybody who comes in with a cough and a flu, samples are taken automatically. And we continue to analyze this because we don't want to be taken unawares.
As Uganda emerges from the shadows of the COVID-19 pandemic, the crisis has left behind lasting lessons. It exposed critical gaps, but also sparked vital investment in healthcare systems, particularly in critical care and disease surveillance. The experience has underscored one truth: a resilient and prepared health system is not a luxury, it's a national necessity. Walter Mwesije, NTV.